Here's a CT scan that was performed with intravenous contrast, and we can see this large splenic mass. It looks like it has hypoattenuation centrally, most consistent with necrosis. And there are a number of other findings as well. We can see here's the pancreas here, and we can see that there's a mass involving the pancreas. There's another mass here involving the pancreatic head, and we can see other smaller masses involving the pancreas. And then we have a number of renal lesions here as well that don't appear to represent simple appearing cysts. And in the setting of all of these masses here are concerning for metastatic involvement. There's also a retroperitoneal lymph node here, left periaortic, enlarged lymph node with central necrosis. These ended up being a patient with lymphoma, so these are all lymphomatous masses involving the spleen, involving the kidneys, the retroperitoneum, and interestingly also the pancreas. When we think about pancreatic masses, we think about primary pancreatic tumors, but also metastatic disease. The most common metastatic disease to the pancreas ends up being renal cell carcinoma, but it can also be lymphoma. This patient was treated for lymphoma and ended up getting a follow-up, and here's the CT scan here where we can see the splenic mass looks decreased in size from the prior examination, and there's interval near complete resolution of the pancreatic masses. Here's our retroperitoneal left periaortic mass here, much smaller than before, and we can see the renal lesions have by and large resolved. There's still maybe some small ones, but by and large resolved. So all these lesions here were manifestations of lymphoma.